Hello, my name is Serenity, and this is my presentation on the Ebola virus. The Ebola virus is a member of the Filoviridae family and is classified as a filamentous virus due to its long thread-like appearance, which distinguishes it from many other viruses that are spherical or icosahedral. Its structure is quite unique and contributes to how it interacts with human cells. Ebola carries a negative sense single-stranded RNA genome, which cannot be directly translated by host cell machinery. Instead, the virus first has to convert this RNA into a positive sense strand using a viral enzyme called RNA-dependent RNA polymerase. Once converted, this viral RNA can be translated into proteins that allow the virus to replicate and spread inside the host. This virus is enveloped, meaning it has an outer lipid membrane that it steals from the host cell during the process of budding. This envelope is essential for viral entry into the new cells because it contains glycoproteins that interact with the host cell receptors. These glycoproteins allow the virus to fuse with the host cell membrane, injecting its contents and beginning the infection process. One of Ebola's major virulence factors is the very glycoprotein, which not only facilitates entry into cells but also contributes to immune evasion. This virus also releases a secreted form of the glycoprotein called SGP into the bloodstream. This SGP acts like a decoy by binding to and distracting the immune system's antibodies, which helps the virus avoid detection and destruction. Altogether, the structure and function of Ebola virus make it highly efficient and dangerous in its ability to invade, replicate, and cause severe disease. Ebola virus disease is notorious for its fast progression and extremely high fatality rate. It's one of the most deadliest viral infections known to humans. After someone is exposed to the virus through bodily fluids or contaminated materials, symptoms usually start appearing within 8 to 10 days, though it can take anywhere from 2 to 21 days depending on the individual's immune system and viral load. This incubation period makes tracking and controlling the virus more difficult during outbreaks. Initially, symptoms can be mistaken for other common illnesses, such as the flu or malaria. Patients often report fever, chills, headache, sore throat, and fatigue. These nonspecific symptoms can delay diagnosis, especially in regions where multiple diseases are common. As the disease progresses, more severe symptoms develop, including vomiting, diarrhea, abdominal pain, and skin rashes. One of the hallmark signs of advanced Ebola is bleeding, both internal and external, which results from the virus attacking blood vessels and reducing clotting ability. Patients may bleed from their gums, eyes, or even from needle puncture sites. Ebola also causes widespread inflammation and organ damage, particularly in the liver, kidneys, and immune system. This can lead to septic shock and multiple organ failure, which is often fatal. Organ signs such as bleeding gums and painful swallowing are common and add to the distress of patients in the latest stages. Ebola is geographically limited, but still poses a global health threat due to its high mortality rate and potential to spread quickly during outbreaks. The virus has been mostly commonly reported in Central and West African countries, where outbreaks have been linked to contact with wildlife or infected individuals. Some of the hardest hit countries include the Democratic Republic of the Congo, Guinea, Liberia, and Sierra Leone. These regions often face healthcare infrastructure challenges, which can complicate the response to outbreaks. The most devastating outbreak occurred from 2014 to 2016 in West Africa. During this time, more than 28,000 people were infected and over 11,000 died. It was the first time Ebola spread to urban areas, making containment much harder. The case fatality rate varies by virus species and treatment conditions, but can range from 25% to as high as 90%. Groups most at risk include healthcare workers who treat infected patients, family members involved in care of burials, and people participating in traditional burial rituals, which often involve direct contact with the deceased. These practices, though culturally significant, unfortunately contribute to the virus's spread. Ebola is a zoonotic virus, which means its natural hosts are animals and not humans. The primary reservoir is believed to be fruit bats of the Pteropodidae family. These bats carry the virus without becoming sick and can pass it to other animals and humans. Humans typically come into contact with the virus through hunting or consuming bushmeat, particularly from infected bats, monkeys, or antelopes. This transmission can occur during hunting, butchering, or preparation of meat. Once the virus enters the human population, it can spread through direct human-to-human contact. Now, it's important to note that non-human primates, like chimpanzees and gorillas, are not reservoir hosts. They become sick and often die from the virus just like humans do. Because these animals can also act as intermediate hosts, managing Ebola outbreaks requires controlling not only human infection, but also interaction between humans and wildlife. Prevention transmission at this stage is crucial to avoid future outbreaks. Now, unlike airborne diseases like COVID-19 or the flu, Ebola is not transmitted through the air. This means that coughing or sneezing won't spread it. Instead, Ebola spreads primarily through direct contact with infected bodily fluids, such as blood, saliva, vomit, urine, feces, breast milk, and semen. Contaminated objects like needles, medical equipment, or clothing can also carry the virus. A significant mode of transmission during outbreaks has been unsafe burial practices. In many African cultures, it is customary to wash and handle the body of a deceased loved one, but if the person died of Ebola, their body remains highly infectious. Sexual transmissions is also a concern because the virus can persist in semen for more than a year after recovery. This means a survivor could unknowingly pass the virus to a sexual partner long after they appear healthy. Preventing the spread of Ebola involves strict use of personal protective equipment, isolation of infected individuals, thorough disinfection procedures, and public health education to adapt cultural practices without compromising safety. Unfortunately, there is no universal approved antiviral drug that cures Ebola. However, supportive care has proven to significantly improve survival rates when applied early and consistently. Supportive therapy includes managing fluid and electrolyte loss, maintaining oxygen levels and blood pressure, and treating secondary infections. This type of care helps keep the body functioning while the immune system fights off the virus. In recent years, researchers have developed and tested a few experimental treatments. ZMapp, for example, is a cocktail of monoclonal antibodies that target the Ebola virus, helping the immune system recognize and destroy it. Remdesivir is another antiviral drug that has shown promise by inhibiting the replication of the virus's RNA. On the prevention side, there's now an approved vaccine, also known as Ervebo. This vaccine is administered to people at high risk, such as healthcare workers or close contacts of confirmed Ebola cases, and has proven effective in reducing transmission. Survivors of Ebola generally develop antibodies, but how long that immunity lasts is still being researched. Now for the tests, accurate diagnosis is essential to control an Ebola outbreak, especially since early symptoms mimic other diseases. The gold standard for Ebola detection is the reverse transcription polymerase chain reaction test, or RT-PCR. This test identifies the virus's RNA in blood or other bodily fluids and is both sensitive and specific. Another method is ELISA, which detects either viral antigens or antibodies produced in responses to the virus. In high-security laboratories known as BSL-4 labs, scientists can also grow the virus from patient samples, although this is rarely done outside of research settings due to safety concerns. During outbreaks, rapid diagnostic tests are often used in the field to quickly screen and suspect cases. Thermal scanning and symptom questionnaires are also used at airports and borders to catch cases before they spread. One of the most important developments in recent Ebola research is the creation of the Ebola data platform. This platform was launched in response to the lack of standardized, accessible information and data during the 2014-2016 outbreak. It brought together more than 13,600 patients' records from 22 treatment centers across 4 countries: Guinea, Liberia, Sierra Leone, and Nigeria. This centralized database included clinical symptoms, treatments, outcomes, and even viral strain information. Researchers use this massive data set to study trends, evaluate the effectiveness of treatments, and understand factors that influence survival. What makes the EDP particularly impactful is that it promotes collaboration among scientists and health professionals in Ebola-affected regions, ensuring that local researchers also benefit from and contribute to the science. It sets a precedent for how we handle data sharing in the future outbreaks, not just for Ebola, but for any emerging disease. In summary, the Ebola virus is one of the most dangerous pathogens known to humans. Due to its rapid transmission, high fatality rate, and severe symptoms, while it primarily affects people in Central and West Africa, its potential to spread globally makes it a concern for everyone. The good news is that advances in research, data sharing through platforms like the EDP, experimental treatments, and the rollout of effective vaccines have all improved our ability to respond to outbreaks. Ongoing public health education, strong healthcare systems,